Good evening, everyone, and welcome to all of you once again for this exciting webinar from Thumbay University Hospital. Uh, I'm sure you had finished your iftar and you would have been in a relaxed mood now to listen to an exciting webinar from Thumbay University Hospital. Today we have Dr. Satyabrata, who is a specialist from Center of Urology, and he has got tremendous areas of expertise in laser treatment of urinary stones. We have laparoscopic and robotic surgery, prostate disease and cancer, male erectile dysfunction and infertility, cancer of kidney and urinary bladder, urinary tract infections for children and adults, urinary incontinence, and overall bladder problems. So I'm sure this is a very important webinar because the summer is coming, and I'm sure a lot of you people will have certain problems in urology, and you could make use of the information shared by our doctor. So I would like to welcome our doctor today, who is going to give you a brief webinar. So if you have any questions, you can enter it into the chat. My colleague, Mr. Deepu, is there online, who will look at the questions at the end of the webinar, and he will guide you with the doctor will answer all your questions. So welcome, doctor. Welcome to this exciting webinar.
Thank you.
You can start, you can start with the webinar.
Good evening, everybody. I am Dr. Satyabrata Garanayak. I am a specialist urologist working in Thumbay University Hospital. So our hospital is a 200-bedded multi-super specialty hospital, which is giving all the state-of-art technology in the urology field. So today our topic for discussion is renal stones and their management. So we know for this is not playing. For years, the kidney stones have been a cause of agony, pain, and misery. So this is one of the most common afflictions of the modern society. The lifetime prevalence of stone is 1 to 15%, and the peak prevalence is 30 to 70 years. That is, mostly it affects the middle-aged people. So what is a kidney stone? This is a hard mass which develops from crystals. This may be of various compositions. It may be calcium, it may be oxalate, it may be uric acid, it may be phosphate, or it may be cysteine, or it may be a mixed substance. This occurs due to accumulation of these various substances. The causes are mostly dehydration. The working in hot and humid conditions, it is the most common cause in UAE. pH imbalance in the urine, gout, the uric acid problem. People having uric acid problem, they should be cautious and take medication or diet restriction, otherwise they will end up in having a kidney stone. And people having parathyroid disorder or those who take unnecessary calcium supplements, they are also more prone to kidney stone formation. So these are the risk factor: low fluid intake, diet which is high in animal protein and salt, those who restrict dietary calcium, consumption of calcium, grapefruit juice, spinach, peanuts. Then some medications can also cause kidney stone, like the vitamin C and calcium supplements. And patients who have gout, that is the uric acid problem, nephropathy, obesity, they are also more prone to have stone formation. Now, 80% of the stones are less than 2 millimeter in size, and 90% of the stones, they pass spontaneously. Types of stones, the most common stone is the calcium oxalate stone. It can be also calcium phosphate. Patients who have urine infection, they have more chance of struvite stone. Cysteine stone in patients with a congenital disorder, that is the cystinuria, and uric acid stone in patients with gout. So how the stone forms? Stone forms when there is dehydration, then the crystals start to accumulate. They keep on accumulating, and if you don't take precaution, then they lead to stone formation. So how the patient presents? The patient normally, they may be either asymptomatic, like patients having stone, but they don't have any pain. But most of the time they present with severe flank pain, which is like pain in the back, which is radiating to the groin. They may have nausea, vomiting. They may have blood in the urine. And normally the pain is not subsided with oral painkillers. So they have to come to the emergency to take painkiller injections. So how do you know whether it is due to stone or it is a normal back pain? Because the pain is in the back. So the stone pain is normally one-sided. This is not affected by any position or activity, and it normally radiates to the testicles. But the musculoskeletal pain is often bilateral. It increases with activity. So more in the evening, and this can radiate to the buttocks or down to the thigh. So this is a typical area of the pain due to kidney stones. So now this is the anatomy of our urinary system. We know there are two kidneys, and there is a urinary bladder, and the pipe connecting them is called the ureter. So stone can be either in the kidney, in the ureter, or in the bladder. Now when the patient comes, so we do some investigation, that may be the blood or urine investigation, and also the X-ray and ultrasound. And treatment may be by medical treatment or by surgical treatment. So when the patient comes to emergency, we do some blood tests, we do urine tests, X-ray, ultrasound, and CT scan. In urine test, we look for any infection, and also we can see various type of crystal like cystine crystals, or so we get an idea about what the stone is. See, in the X-ray, we can see the stone, but some 20% of the stones are not seen on X-ray. So we have to go for a ultrasound. So ultrasonography is, available almost in every clinic, and it is not associated with any radiation. So this is a study when stones are not seen in the X-ray. So this is normally the initial screening study. So see, in the ultrasound, we can see stones. Sometimes some stones are not seen in ultrasound also. In that case, so doctor will prescribe you a CT scan. So you see in this CT scan, the stone is clearly seen in the kidney. Now coming to the treatment of kidney stone, it is either medical treatment, which includes, as we give various painkillers, antispasmodic drugs, and if there is fever or any sign of infection, then we give antibiotics. Now surgical management again depends on various factors like the stone size, the site, whether it is in the kidney or the pipe, and also depends on the patient factors like obesity, anticoagulants, and pregnancy. So now coming to the medical management, this is a data which is showing if the stone is less than 4 millimeter, there is a 96% chance of passage. If it is between 4 to 6 millimeter, there is 80% chance of passage. If it is between 6 to 8 millimeter, 60% chance, and if it is more than 8 millimeter, then there is 20% of chance of passage in a span of 3 months. So this is a brief video I am playing. So for the medical manage regarding the spontaneous passage of the stone. You share this one. Huh? Okay. So if it is a small stone, we can wait for the stone to passage, like if it is a 5 or 6 millimeter stone. So it can pass through the ureter and reach the bladder. The benefits of observation is that you avoid having any surgery. But problem is that the stone may increase in size. It may get stuck in the pipe. It may cause damage to the kidney in the long term. It may cause super added infection. And in the time, the stone may also grow in size. So when the stone passes through the ureter, it causes a lot of pain. It may cause blood in the urine. It may cause nausea. This may cause vomiting. If you are initially symptom free, then there is 1 in a 10 chance that you will have pain. So if the stone doesn't pass with medication, then you will be referred to a urologist. So I'll come back. Huh? So next is lithotripsy. Now we have 3 modality of treatment, surgical treatment. One is the lithotripsy, one is the ureteroscopy, and other is the percutaneous nephrolithotomy. So lithotripsy, the stone is broken by shock waves, which are generated by electromagnetic generators. So this is the indications: stone up to 2 centimeter can be broken in the kidney, and a stone up to 1 centimeter in the ureter can be broken. Contraindications: it cannot be done in pregnant females if there is active infection, if the stone is near any tumor, or patient is on anticoagulants, then we cannot do this. The advantages are: this is non-invasive, normally a daycare procedure, and this is very safe. No anesthesia is needed. Short treatment, patient can come in the morning and go in 6 hours to home. The disadvantages are that it may need repeat procedures. This is not suitable for all patients, and pain can occur when the stone passes in the ureter. So if the stone is more than 1 centimeter, normally we put a DJ stent so that the pain doesn't happen due to passage of the stones. The problem with ESW is stone may not break at all. In obese patient, because of the stone to skin distance is more, so shock waves cannot reach the stone. And if some stones are very hard, like the cystine stones, they are not suitable for lithotripsy. There is a video I'm sharing again regarding the lithotripsy. So this is how the lithotripsy is done. The patient just lies on a table. This is just like a CT scan machine. The shock waves are generated from below. The patient just has to lie down, and they come and break the kidney stone. They fragment it into small pieces, which then pass through the ureter. Normally, we don't give any anesthesia. We just give topical anesthesia, that is a local anesthesia cream. So patient can go home on the same day. If patient is on any blood thinning medication, he has to stop the medication. So when the stones pass, the patient may have discomfort, flank pain, bruising, nausea and vomiting, and blood in the urine. So there is 1 in 1,000 chances of bleeding, so which may need blood transfusion. And there is 1 in 100 chance of doing a second procedure like DJ stenting. And sometimes the patient needs medical attention. Stops. Now next is ureteroscopy. This is done when the stone gets stuck in the ureter, or when there are small stones in the kidney. The flexible scopes, they can go up to the kidney. Normally the stone is broken by laser, and stone is removed using various baskets. So now again, I'm sharing a video for the ureteroscopy. So there are very small scopes, just like wires, which can go through the urethra to the ureter. They can reach up to the stone. So stone is normally seen. Then it is broken with laser. There are very holmium laser available here. They are broken into small pieces, small fragments, and these fragments can be retrieved with using various type of basket. You can see they can. So this is normally a daycare procedure. Patient comes in the morning and they can go by night. This is normally done by general anesthesia. There are few complications that may happen. 1 in 100, there is a chance of injury to the ureter, and there is a chance of ureteric perforation. So normally after the procedure, we put a DJ stent. So what is a DJ stent? It is a hollow rubber tube, normally 10 to 12 inches long, which is used to, we put it from the kidney to the bladder. So it keeps the ureter open. And when small fragments they pass, they normally do not cause any pain to the patient. Now next is PCNL. PCNL is normally done for big stones, stones more than 2 centimeter of size, which are not cleared by any other method. Then we do a PCNL. In PCNL, we make a hole from the back, go to the kidney, break the stone and remove it. We make a small hole of the size of a button. So now again, I'm playing a video of the PCNL. So in PCNL, from the back, we make a small hole of the size of a button hole. We go directly into the kidney, break the stone with laser and remove all the stones. Normally, patient has to stay 1 complete day in this procedure, and it is normally done under general anesthesia. In this, the complication can be sometimes there is bleeding, which can happen in 1 in 100 cases, which may need transfusion. And after the procedure, similarly, we put a DJ stent, that is a hollow rubber tube from the kidney to the bladder. Now, open and laparoscopic surgery in 5 to 10%, if the stone is not cleared by any of the above methods, then we go for open or laparoscopic surgery, which is known as nephrolithotomy, pyelolithotomy, ureterolithotomy, which is rarely we do in 3 to 5% of the cases. Now, when you do the surgery, we remove the stone, we send it for analysis, we get an idea about the composition of the stone, and accordingly, we give advice to the patient. So, post surgery, the follow-up is also important. Patient is given advice regarding the fluid and water. So, in fluids, the goal is to produce 2 liters of urine in a day. So, normally the patient should take 3 to 4 liters of water in a day, and if it is hot and humid climate, he can go up to 5 to 6 liters. Citrus juice and lemonade are good choice because they have got high citrate, and high citrate is a stone inhibitor. Moderate calcium is recommended. Normally people say that stone you don't take calcium, but it is better to take moderate calcium. Low calcium intake actually increases the risk of stone formation. Supplemental calcium should not be taken. Unnecessary taking calcium supplement, they can cause stone formation. So general dietary recommendation are, you have to minimize the red meat intake, decrease the salt intake. Vitamin C, if you are taking, you should limit the daily intake to 750 milligram per day. Multivitamins are okay, you can take the multivitamins. Animal protein, patient who are stone formers, they should avoid taking animal protein like red meat, fish and poultry, because it increases the uric acid level. So chances of uric acid stone formation are more. It decreases the pH of urine, which can again, lead to uric acid stone formation, and it itself increase the urinary calcium. So the patient with kidney stone, they should avoid the red meat. Then patient with oxalate stone, they should avoid tea, coffee, tomatoes, spinach, okra, nuts, and pepper. Thank you.
Thank you, doctor, for your highly informative discussion on kidney stones and how to manage it. We have one question from
Yes.
one of the attendees.
Yes.
Who is asking, his name is Mr. Robert.
Yeah.
His question is, doctor, do children get kidney stones?
Yes, but normally kidney stone in children, they are seen mostly in developing countries. You see in India and Pakistan, Sri Lanka, we see more kidney stone. In developed nation, normally kidney stone incidence is less because it is mostly dietary. But in children, they respond very nicely to lithotripsy. Normally, they don't need any open or endoscopic surgery. You do lithotripsy, they respond very nicely to lithotripsy.
Thank you, doctor. I can't see any more questions. Thank you on behalf of Thumbay University Hospital. We would like to thank everyone for attending this webinar. We will come up with more exciting and interesting health talks from our specialist in coming days. We want to thank all the attendees who has joined, and we wish you all great holidays and Ramadan Kareem. Thank you.
Ramadan Kareem.
Thank you.